My name is Bonnie Adamson and I'm President and Chief Executive Officer of London Health Sciences Centre. I'm very pleased this morning to welcome the Honourable Deb Matthews, Minister of Health and Long-Term Care and MPP for London North Centre, the Honourable Chris Bentley, Minister of Aboriginal Affairs, Attorney General and MP for London West, and Khalil Ramal, MPP for London Fanshawe, and Jeff Lowe, our Chair of the Southwest Local Health Integration Network. As well, I'd like to have a very warm welcome to the members of the media of London and surrounding areas, and as always, our staff and physicians of our Orthopedic and General Surgical Unit on London Health Sciences Centre. I would also like to extend a very special welcome to Dr. Gillian Kernahan, President and Chief Executive Officer of St. Joseph's Healthcare London, and Marcelo Grail, the Chair of the St. Joseph's Healthcare Centre London. And unfortunately, Peter Johnson, our Chair of London Health Sciences Centre, was unable to attend this morning. He sends his regards. We have enjoyed the opportunity to visit one of our surgical patients this morning, and you've no doubt taken notice of our fabulous new facility that we have here. Our patient rooms are very warm, a very calming environment that offers lots of light, the best view in London, and as well houses the latest controls for infection control. We take great pride in these new physical spaces, and we're even happier to share examples of extraordinary, exceptional care that our staff strive to provide each and every day at London Health Sciences Centre. Now, I'm sure I speak for everyone here. We are very much looking forward to this new announcement, and it's my pleasure to introduce the Honourable Chris Bentley.
Thank you very much, Bonnie, and thanks to you, to Gillian, Jeff, to all those who make healthcare in London as good as you'll find anywhere in the world. I want to thank the doctors, the nurses, the allied health professions, whether you work in our hospitals or outside, the administrative and support staff. We have a centre of excellence for the world in healthcare in London, and it's because of the hard work that you do every single day. Not always in easy circumstances, but enormously important. I just want to thank you for that. It is noticed. It's noticed in our community. It's noticed beyond. We're back here again, in my riding of course, but back here again. So there must be a good news announcement, because with our Minister of Health and MPP for London North Centre, we have been making a lot of announcements, Khalil and I, and Deb, about improving access, improving the availability of services, improving the quality of those services, and improving the quality of the infrastructure. And Khalil and I have been able to either introduce or thank the Minister for quite a few. It was only a few weeks ago that we were here, so I'm standing in great anticipation of some more good news today. And I'm sure, Khalil, when you get up, you'll be talking about the great news. It's all about our commitment to the people of our community and the people of the province of Ontario. That's what it really is. That's why we're here. We all know that without your health, life is very, very difficult and very challenged. And when we come here or other great facilities in London, we get the best care possible. And to hear about further enhancements to that care, I am delighted to introduce not only the MPP for London North Centre, but the Minister of Health and Long-Term Care for the province of Ontario, Deb Matthews.
Well, thanks, Chris, so much. And you're right, we do seem to come here for good news, and we do have more good news today. But before I talk about that, I do want to take a bit of a big step backwards and think back to the days when LHSC and St. Joe's operated pretty independently, and 3 women, as I understand the story, 3 women got together and decided that we could do a lot better if we worked more closely together. So back in the 90s, that journey began, and maybe we'll do a little history lesson. I know Sylvia Davis was one.
Kelly Butt.
Kelly Butt. Oh, we'll have a quiz, a prize for the person who...
And
Trish
Hubble.
Fulton.
And Hubble.
And Hubble. Okay, more than 3 women. But they just knew that we could do better for the people we serve if we worked more closely together. That restructuring, part of that restructuring was really looking at our built environment, our infrastructure, and thinking about what we needed to do differently in terms of the buildings in which we work to provide that improved care for people. And Dave Crockett started on that journey a long, long time ago. And I am enormously pleased to report back that after 8 years that our government has been in office, we have spent $1.6 billion on capital infrastructure in the London hospitals. $1.6 billion. We are celebrating the beginning of the third and final phase. I think it is nothing short of remarkable. We have virtually rebuilt the hospitals and enormously expanded capacity here in London. I want you to know that across the province, we inherited a very serious capital infrastructure deficit. The proper investments had not been made over governments of all stripes, because it's always easy to defer that expenditure. But the reality is that if you keep deferring, you're eventually going to have to pay up. And when we came to office in 2003, we decided to tackle the infrastructure deficit, and we allocated a significant amount of money, billions of dollars, to Renew Ontario to start rebuilding the infrastructure deficit. London hospitals did really well under Renew Ontario. London hospitals really got to the front of the line. I can tell you across the province there are still hospitals, many, many hospitals, that are still waiting for their turn to come. So we have to be grateful here in London, because this $1.6 billion, I have to tell you, came from taxpayers right across the province. So I'm going to ask all of you to pick up the phone this afternoon, call a friend or a family member who lives somewhere else, and just say thanks, because we really are appreciating the donation you made to get the London hospitals where they need to be. So we are celebrating the beginning of the third and final phase of redevelopment here in the London hospitals. That redevelopment, of course, when you add space, you need to actually fund the additional services in that space, because there's absolutely no point having a building if you don't have nurses and other healthcare professionals working in those buildings. So I'm very happy also to report that as we open new space, we have what we call PCOP funding, post-construction operating, whatever the last P stands for, plan. Money. Health is a world of acronyms, you know, it's just alphabet soup. I swear they get alphabet soup and pull out the number letters and decide what they're going to call the next program. But PCOP funding. So last year's PCOP funding has been used to open 69 additional beds. An additional 38 beds were found within the global budget of LHSC. They worked very hard to look very closely at where they were spending money that they didn't have to spend, that they could convert into frontline care, better frontline care. An additional number of beds will be able to result from today's announcement. I'm very pleased to say that another $21.9 million will be added to the base budget of LHSC. That will allow the opening of an additional 34 beds. So $21.9 million in PCOP money for LHSC, an additional $1.1 million to St. Joe's, so they can continue to expand the services offered in their new space. We're also here, as I say, to celebrate the third and final phase of expansion, which will create the space for an additional 161 beds for future use. So all in all, we've come a long, long way in London. I had a look at the wait times as I was preparing for this morning's event, and dramatic improvement. The wait times for hip replacement surgery has been cut in half, knee replacement surgery cut in half. Those are important numbers, But I tell you, when you think of people who are waiting in pain for a procedure that they're going to get sooner or later, I think we all want to get that procedure done sooner so people can get back and enjoying their life, out playing with their grandkids and getting back to work in some cases. So we've come a long, long way. The MRI wait times have come down dramatically. I think, if my memory serves me right, by 80%. Wait times have been reduced for MRI. So all in all, we've got lots more nurses working. 150 more nurses have been hired or will be hired with this new additional funding. So we've come a long way when it comes to improving healthcare for the people of this community. I want to say thank you to Jeff Lowe, the chair of the Southwest LHIN, for his contribution to the improvement of healthcare in this community. Because of the LHINs, we are now able to work in a much more integrated way. We're getting people who are in hospitals, who can be at home, who could be getting the care they need at home, out of hospitals, and back home more quickly now, thanks to the work of the LHIN. There's a lot of good news happening in healthcare in London, and I'm delighted to be here to celebrate the beginning of Phase 3 and the funding for the progress we've already made. Thank you so much.
Thank you, Minister, for this incredible news. And I also want to thank my colleague Chris Bentley for predicting this good news. It seems he has the ability to read the future. Maybe after we finish here, I'm going to take him outside and ask him what's going to happen October 6th. So hopefully give me a good reading and good news about the future. It's indeed an incredible investment. And always, I say we are lucky, we are privileged to have a strong leadership in the City of London and the health community to put the whole pieces together and come in an incredible plan and convincing plan to the Ministry of Health. And beside that, I think we are lucky to have a good connection to the Ministry of Health to give us the chance to invest more than $1.6 billion for the last 4 years in the health care capital infrastructure. And besides that also, not just about the buildings, we need the money to operate those buildings. And I think today, Minister, this news is incredible news, not just to build, and also to make sure all this building be utilized and benefit the City of London and surrounding area. So I guess you and I and Chris and many of us who went to the room, we saw how much important to many constituents of this region, to have a good hospital, good shaped hospitals, inviting hospitals, because of people when they are sick, they want to see a beautiful environment and to see a good service, good nursing, and also a good environment. So I think it's an incredible day for London and for the region. And congratulations for both St. Joseph and London Health Science Centre for this incredible investment. And no doubt in my mind, this investment is going to give you the chance to service many people of this beautiful City of London. And I know when I knock on doors on a daily basis, the main issue, the healthcare. The main issue in the healthcare, and I think will remain the main issue in the future in the healthcare. How we can utilize our precious taxpayers' dollars to be reinvested, I think is going to be the key for success in the future. So as you know, and Minister, you talk about it all the time, we are growing old in this society. I think we have a certain amount of money. We have to prioritize where we spend them. I think the healthcare is important to revamp on a regular basis and to try to utilize every penny in the right directions, in the right place. So again, congratulations, my best wishes, and hopefully we'll see you again. Thank you.
Thank you very much. The Ontario government's continued investment in the future of healthcare in London is tremendous news and will allow us to take patient care to even higher levels. I'm particularly grateful for the funding because it is an important enabler for improving patient access and infection control, two of the highest priorities at London Health Sciences Centre. This $21.9 million of funding lets us continue to take advantage of this fabulous new space created at the Victoria and Children's Hospitals and turn it into wonderful new services. This includes a plan, as the Minister said, to open 38 new beds by the end of this year, which includes 6 new surgical beds on this floor, which will further ease the pressure on our emergency departments and inpatient units. This increased capacity will allow us to reduce wait times even more and admit more patients to hospital beds more quickly. The funding will also allow us to increase our patient volumes in a number of ambulatory care areas. So we thank you for the provision of this very important funding and for your continued commitment through this entire long journey of restructuring. And we look forward to our ongoing partnership as we embark on the final phase of this restructuring journey with the official start of Milestone 2, Phase 3. And this will include continued expansion of services and further consolidation of areas of care in our purposefully built facilities. We would also like to extend our thank you to Infrastructure Ontario, because without their continued support, M2P3 would not have been possible. And at the same time, we look very forward to our continuing partnership with St. Joseph's Healthcare London. We have 13 years of successful togetherness on our restructuring journey, and I cannot imagine a more important or a more valued partner in our healthcare system to work with, going every step as we go forward, as we work towards the completion of acute care restructuring in London. It's a very important partnership, and we value it very much at London Health Sciences Centre. Together, with the collective support and the leadership of all the partners in the room today, we together are able to better meet the needs of the patients and families in the community of London, Southwestern Ontario, and beyond. So it's now my pleasure to invite Dr. Gillian Kernahan, President of St. Joseph's Healthcare London, for a few words.
It is my pleasure to be here today with our partners, London Health Sciences, the Ministry of Health, and the LHIN, to celebrate the third and final phase of acute care restructuring, although we know we have a lot of work to do in the mental health area as we build 2 new buildings. On behalf of St. Joseph's, our board, our staff, our patients, and our community that we serve, I would like to thank the Ministry. It is very important, this $1.1 million of post-construction operating funding, because it does allow us to serve more patients in our community. With this latest installment, St. Joseph's will continue to develop the specialized and acute care programs to provide the exceptional patient experience they deserve, interprofessional care and education on a nationally recognized platform. The goal always is to provide the best possible care and service for patients within the London Integrated Healthcare System. This is an exciting and transformational time. As I've said to people, we're on the 14th year of a 5-year journey for St. Joseph's as we create the unique specialized ambulatory care model at St. Joe's. We will build on world-renowned successes in the care and research for patients with injury, disease, visual impairment, chronic illness, and age-related conditions. With the continued support of the Ontario Government and our strong alignment with London Health Sciences, we have achieved the most integrated health system in Ontario. We provide innovative solutions to assist each individual in their journey of healing and health management, and we do that together. At St. Joseph's, we're known for compassionate care, and through this investment, we will be able to provide that care to more people in our community and the region. Also, with the next stage of investment through Infrastructure Ontario, we will continue to develop state-of-the-art facilities that are really built for new care today, which is focused on providing care in hospital when it's needed, but unique ambulatory care solutions, surgical solutions, and solutions together with London Health Sciences. So together, London Health Sciences and St. Joseph's and our community partners, we will transform healthcare in our region to sustain care, teaching, and research for future generations. Thank you very much for coming today.
I would now like to ask Jeff Lowe, Chair of our Southwest LHIN, to speak, please.
Thanks, Bonnie, and I'll be very brief. One of the real privileges as chair of the Southwest Local Health Integration Network is the opportunity to travel throughout Southwestern Ontario to all the health service providers and see the great work that's being done. And I can tell you, I know every back road and every shortcut that exists in Southwestern Ontario at this point in time. I will say, however, that wherever I go, people continue to hold up the work that's being done in London and the integration work that's being done in London as an outstanding example of where the integration process works. It's just a real privilege and a real pleasure to be able to talk with people and spread the good news everywhere. You know, today's announcement here in London is fantastic. it's good news for everybody. I remember when Joe Gilbert was the head of research at London Health Science Center. He said, you know, Jeff, he said, the research is what puts the aha and magic into the bedside, into the patient care. He said, but let's face it, if there's no lights, there's no water, there's no heat, the magic doesn't go very far. So this is an extremely important announcement. So again, on behalf of my fellow directors at the Local Health Integration Network here in Southwest, and on the staff, the hardworking staff and somewhat nervous staff at the LHIN right now, I want to thank you, Minister Matthews and Chris and Khalil and the CEOs here and all the volunteers and hard workers that make this type of situation possible. So greetings and thank you very much.
So in closing, I want to thank everyone here today for this wonderful announcement. The generous growth funding announced by the Minister will make a real difference for those in need of care in London, Southwestern Ontario and beyond. The delivery of care in our city, London, Ontario, will continue to be reshaped for the future with this exciting start of new funding for Milestone 2, Phase 3. So thank you very much again. Have a wonderful day. And I'd like to let the media know that there will be speakers this morning that are able to have interviews if you choose to. So thank you very much once again. And have a good day.